All right, well, good afternoon. We haven't done this in a couple of weeks, but we have a couple of issues that I think are of real importance to the residents of the city of Detroit that I wanted to address directly. There is probably no issue that is raised with me by Detroiters with greater frequency than the speeding that is going on in this city. And since COVID, when it seems like there are fewer cars on the streets, more of them are driving at unsafe speeds. And we really need the drivers of the city to be respectful of the other members of the community. It's amazing the way the city has watched out for each other, wearing masks and distancing on COVID, and yet what has happened on the streets has been just the opposite in Detroit. Year in and year out has more pedestrian-related deaths than just about any other city in the country. We are dramatically ramping up the police department. We're getting 35 to 40 new recruits into the classes every month, and over the next year there will be more police officers in the precincts, and the precinct commanders will like nothing better than to be expanding their traffic patrols. But in the meantime, we need to take more decisive action, and I'm not sure there's been any innovation in this city that has been received with more enthusiasm than the speed humps, which we started 3 years ago as an experiment, and this year we put in 1,200, basically slowing down traffic at parks and schools across the city. The more we put in, the more I have heard from neighbors who say, we need these speed humps on our street. And so we don't put them in without checking with the neighborhood, because we have a few neighborhoods that think they're an inconvenience, but by and large they are overwhelmingly popular. So we did 1,200 this year. Next year we are going to more than triple that. We are going to put in 4,500 speed humps, and everything comes at a cost. We are going to have to defer some road resurfacings in this city, which have been going at a pretty rapid rate in recent years. You've seen a lot of roads resurfaced in Detroit. We're actually going to slow the resurfacing down a little bit next summer in order to give the priority to what I think most Detroiters want, and that's to make the neighborhood safer. So Ron Brundage, our DPW director, is going to take you through the details, but it's going to be relatively simple. We are going to go out for bids this fall to contractors who can install 4,500, and then over the winter, the engineers and the roads department are going to decide. It's not going to be based on who makes the most phone calls. That's not the right way to do road design. It's going to be streets that are 25 miles an hour. We can't put speed humps on the faster streets. It just doesn't work. But if the street you're on is 25 miles an hour, it's going to be 3 calculations. How much traffic is there? How many children are in your neighborhood? And what kind of reports do we have of speeding, either from the police or others? And we are going to pick the 4,500 blocks in this city that have the most traffic, with the most children, with the most speeding. We know there are particular places where people use streets as cut-throughs to get around traffic or construction. Those are going to be targeted in particular. But next year you are going to see a dramatic increase. And with that, I want to turn it over to the man who's responsible for doing this, our DPW Director, Ron Brundage.
Thank you, Mr. Mayor. As the mayor indicated, next year's program is going to be an expanded program compared to this year, as well as 2018, 2019. And we're looking at installing 4,500 individual speed humps or speed cushions throughout all of the 7 city council districts in the 2021 construction season. This particular map shows that in 2018, we started it out as a pilot project. We selected 1 residential corridor in each of the 7 city council districts, and we selected, for the most part, corridors that were adjacent to parks or schools, where we felt that there might be a higher percentage of pedestrians, especially school-aged children, that were likely to cross the street. And as the mayor indicated, the pilot program was extremely successful and extremely well received, and it resulted in us increasing our program in the subsequent years. In 2019, you can see that we installed 543 speed cushions throughout the entire season, obviously a dramatic increase over what we did in 2018, and then that continued into the current construction season 2020, where by the end of the construction season, we would have installed at least 1,200 speed cushions throughout most neighborhoods throughout the city of Detroit. As the mayor indicated, obviously there's a cost that goes along with increasing our program as we anticipate doing in 2020 and 2021. One of the great things is that over the last 7 years, we've been averaging between 80 to 100 miles of streets that we've been paving each year. And it's resulted, for the most part, in our city jurisdictions, roads throughout the city, being in very good condition. And we're really not getting a lot of complaints from residents as it relates to the condition of roads, potholes, et cetera. And it puts us in a position whereby we could successfully divert some of our road transportation funds to this extremely, not only popular, but extremely important program that is extremely effective in reducing the amount of speeding that occurs through our residential streets. As the mayor indicated, we're going to utilize very strict criteria in terms of identifying which streets are prioritized for speed cushions. And we're really going to base it on, those streets that ultimately it's going to create the maximum amount of effect when the speed cushions are installed. We're going to be looking and performing traffic counts on all of the different streets that are being considered for speed cushions. And we're going to be looking at residential streets that have a daily traffic volume of at least 1,000 vehicles a day going through those streets for consideration. We're also going to be looking at the number of residents, especially school-aged children that live on the street. Obviously, we understand that the greater number of school-aged children that are on the residential street, that increases the potential for kids going out into the street. And obviously, those streets become the most important when we want to think about putting in impact that can reduce the amount of speeding or reckless driving that might occur on the street. We're also going to take into account information that we routinely get from the Detroit Police Department. We constantly receive reports from them indicating, where they're aware of excessive speeding, and they may not always have the ability to send traffic officers out to each of these different locations, but they're providing us this information, and we'll certainly take that into consideration as we go about defining which streets are ultimately selected. And then we're also going to place special emphasis on streets that are used as cut-through streets. And we've got several of those throughout the city. And these are streets where people want to, for the most part, bypass traffic that exists on major thoroughfares. And they'll use these residential streets as cut-throughs to bypass that traffic on the major streets. And unfortunately, too often, when they use these streets as cut-throughs, they're not always obeying the 25-mile-an-hour speed limit that currently exists on residential streets. Thank you. Oh, I'm so sorry. I'm so excited that we have one of the residents who actually lives adjacent to one of the first streets that we installed speed cushions during our pilot program in 2018. Her name is Marcia Morrow. She lives in District 1 in Rosedale Park, and I'd just like to bring her up.
Thank you so much for having me. Thank you, Mayor Duggan, for inviting me. We were initially a part of the pilot for the speed humps, and we have had them installed on our street for quite some time now, and it has cut down on the traffic tremendously. About a week before the speed bumps were placed, there was a young man who decided that in the evenings or at midnight or at 1 o'clock in the morning, he wants to do a donut right by the school. We have a school right across the street, and we don't know where he came from. But since those speed humps have been there, we have not seen him since. So we just want to thank you. We do live across the street from the school, and Puritan is a main thoroughfare. We know that it's not a whole lot we can do. We have stop signs that are placed on almost every corner. No one recognizes the stop signs. So I'm so elated that you are hiring more police officers so they can come out and just start giving tickets. that's the only way we're going to curb it, because it's nothing we as residents can do but complain, and it's for the safety of our kids and for our communities. So we're just so elated that the speed bumps are there. We're going to work with the city, we're going to work with the mayor, we're going to work with the police department, because where we are, it's a really tight community and neighborhood. We all look out for each other. We do not mind calling. We will take pictures. We will send them of cars who are coming through there violating the speed. We will do whatever it takes to keep our community and our kids safe. So on that point, we just want to thank you, Mayor, for what you have done and what you are doing for the city.
All right, so for all of the people who called in at the 8 community meetings we held in the last 2 months, I just want you to know, the leaders of the city are listening to you, and we're going to respond by making these neighborhood streets safer. I want to talk about another thing that we need to have a candid conversation about, and that's the need to get a flu shot, really in the next month or so. So the COVID numbers are up on the screen. Detroit continues to be the national model, from having gone from among the highest infection rates in America to week after week, we're only seeing 1 or 2 deaths a week. That's 1 or 2 too many, but it is astonishing. And if you look at the infection rates, when we started, the smallest county in this state, Benzie County, had no infections when we were at our peak. I looked at the numbers last week. The city of Detroit had a lower infection rate than Benzie County in northwest Michigan. The people of this city have done an extraordinary job of committing to the mask, of committing to the distancing, and right now the Detroit infection rate is pretty close to the lowest in the state, and that shows you what Detroiters feel about each other. This is going to seem a little bit disconnected, but it's important, and that is we need to get our shots now for the seasonal flu. Won't help you on COVID. COVID vaccine isn't going to be around until January. Here's why getting your seasonal flu shot is important. I used to run a hospital system, and from December to early March, our hospital was full every year because of the flu. I got a bunch of hospital administrators here with me today, and they all benefit financially from flu season. There's national maps that they put out that you can tell where the flu is coming, and it is a significant moneymaker for hospitals. You're going to hear the extraordinary thing. You're going to have a bunch of hospital administrators come up here and tell you to get a flu shot. It's because it's in your best interest, not because it's in the best interest of the hospital. But here's why. As bad as COVID was last March, had it hit a month earlier, it would have been far more devastating, because a month earlier there were no hospital beds. The flu had filled them up, and it's mostly seniors, elderly people who can be there for a week or 2 weeks. In many cases can be on ventilators that we need for other folks. But if COVID comes up this fall, as a lot of national experts think it will, if it starts to come up in November and December, and the hospital beds are already filled with flu patients, we're going to have another crisis. And so this is a chance for you to do what's right for you and what's right for the community. Detroit has historically had one of the lowest flu vaccine rates in the country, and we tend to be a little medically suspicious, and nobody has been more medically suspicious than I've been. I never would get a flu shot. Part of it is I really don't like needles, and so I'd put it off, and I would say half the winters I would get the flu and half the winters I wouldn't. And the winters that I got the flu were 3 or 4 days in bed where you're absolutely miserable. I was thinking about how stupid I was not to get the flu shot. And the winters where I didn't get it, I thought how smart I was not to have been injected when I didn't need it in the first place. When I went into the Detroit Medical Center in 2004 and I saw the science behind it, I realized how stupid I had been, that the flu vaccines typically match up in a very high degree of probability of blocking the strain that year. And so I started getting flu shots in 2004. I get them every year now at the beginning of the season in September. I have not gotten the flu in 16 years. Flu shots work. Now the hospitals, all as far as I know, have mandatory policies that their employees at the hospitals have to get a flu shot, because you can't have people, nurses and doctors and aides interacting with patients who are already vulnerable, having them catch the flu. It's become second nature. But now we need to do something else in the city we don't normally do. Go out and get your flu shot. It's the right thing for you health-wise. It's the right thing for the community. You can go to your local drugstore. You can go to your doctor's office. Denise Fair will come up and show you all the different ways you can get them. And so somehow, when I wasn't looking, my staff voted that I was going to get a flu shot today on TV. I brought the Deputy Mayor, Conrad Mallett, and the health director along with me. We're all going to get our flu shots. The flu shots hurt. But you're over it in a few minutes, and for the next 5 minutes, you're not worried about throwing up for 3 days, laying in bed. It's the right thing to do. So I've given you the non-medical aspect, and now I'll turn it over to the person who will tell you from the clinical side why it's important and how you can get your flu shot, Denise Fair.
All right, thank you, Mayor. So today, the Health Department is launching a citywide public health campaign to encourage Detroiters to get their flu shot, especially for our high-risk populations who are more at risk for experiencing hospitalization and also death due to the flu and also COVID. So beginning October the 14th, let me get my slides correct here. All right, beginning October the 14th, the Health Department will offer free flu vaccinations to Detroit residents living in 21 emergency shelters, 164 adult foster care facilities, and 82 senior living facilities. It'll take us about 10 weeks, and we should be completed by Christmas. Now, similar to our COVID-19 testing efforts, we are increasing access. We are eliminating barriers for almost 7,000 Detroit high-risk residents. Now, we also know about our nursing homes and our seniors who are living in nursing homes. The state and the CMS require that nursing homes offer vaccination to their residents. And so Dr. Rahman and Dave Ye and their teams have been communicating really often with the nursing home directors. We feel really good about the direction that they're heading, and they're already ahead of the game. They're offering flu vaccinations to their residents as well as to their staff. Now, the flu shot is available to all Detroiters aged 6 months and older. So if you want a flu shot, you can go to your doctor's office or your local pharmacy, and it's covered by most insurances. But even if you don't have health insurance, there are many free and low-cost solutions that are available to you across the city. In fact, there's 50 free clinics, there are 17 federally qualified health centers, and 15 school-based centers. You can also go to the Detroit Health Department IMS clinic located at 100 Mac. You can call 313-876-IMS or 313-876-4667 to schedule your appointment today. And you can also go online to our website at detroitmi.gov/flu shot for a full list and details of where you can get your flu shot. Now, I want to switch gears and talk to our employers. It is pivotal that you encourage your employees to get the flu shot this year. Now, Deputy Mayor Conrad Mallett and I have spoken to many of you. You already have really great plans in place, but you are looking for some more resources to help guide you. And so the Health Department has put together a really robust toolkit for local businesses. And there is a plan in place to give you a toolkit with FAQs and print materials that you can use right now for all of your employees. Again, please go ahead and visit our website, detroitmi.gov/flu shot. Now, I'm sure many of you are listening and you're thinking of friends and families who just won't get the flu shot because they feel as though it's going to make them sick. But here's why this year is so important. We are still in the middle of a pandemic. COVID-19 is still real, and it's not going anywhere for quite some time. So since the flu season is upon us, we need to prevent the flu. We need to protect ourselves and the people around us, but also our health systems. We need to reduce the strain on our hospitals that are responding to COVID. So this is the time for us to once again come together and prevent this illness. The mayor is committed, I'm committed, and today we're going to show you just how easy it is for you to get your own flu shot. And we have Essie and also Martez here to help us get the flu shot live right here. Now, I am pleased that 3 of our major healthcare systems are here with us today to help us underscore the importance of getting the flu vaccine. And they've already made the commitment to ensure that all of their employees get vaccinated. So first, I'd like to introduce Bob Riney, who's the Chief Operating Officer for Henry Ford Health System. Following Bob will be Karima Bentunzi, the Chief Operating Officer for DMC and the CEO for the Adult Central Campus. And finally, Joe Hershey, the Market COO for Ascension Health. And with that, I'll turn it over to Bob Riney.
Good afternoon, everybody. I want to reinforce the messages of Mayor Duggan from a personal standpoint, because like you, Mayor, there were years back that I convinced myself that I didn't need the flu shot. And I actually, even though I worked in the industry, got fooled by people calling a lot of things the flu. And so they'd say, well, I had the flu, but it wasn't that bad. Until I learned what real influenza was when I contracted it myself. And that was the last year that I went without a flu shot, and I've never had influenza since, many, many years later. So it's really important that we understand and embrace this. And as a health system that's been at the center of the pandemic battle, and so proud of Detroiters for their compliance, as Mayor Duggan identified, we're just strongly urging everyone 6 months or older to get the flu shot as early as possible. It's really the single greatest measure that we can have and we can do to protect ourselves and our loved ones and the people that we have the privilege of interacting with on a day-to-day basis. You may find this to be a funny message from someone that works in healthcare and we compete with each other. But I'm here to tell you that getting your flu shot early is more important than where you get it. Just please make sure you get your flu shot. Go where it's most convenient for you, your neighborhood pharmacy, your doctor's office, the health department, a senior center. Wherever you go, make sure that obviously you're wearing your mask and you're practicing social distancing. Because of the pandemic, it's really important this year that we all get the flu shot. Even if we have relatively good compliance, it's not anywhere where it needs to be. The flu shot will protect us from serious illness, and even if you contract influenza, you will have far milder symptoms if you have had the flu shot. And as Mayor Duggan said, the flu shot does not protect against COVID. We're committed to doing our part to protect the communities that we serve, including, and most importantly, the residents of the city of Detroit. It's really important that we come together in that same esprit de corps that we've done to help deal with the COVID pandemic. Each one of us does our part and makes a personal contribution by getting a flu shot. So not only am I asking you to get your flu shot, but I'm asking you to encourage your neighbors and your family members to do the same. We are planning for a potential surge of COVID cases this fall. A surge of COVID cases on top of a strong influenza season would put us in a very, very dire position, and none of us want to repeat what we had in late winter and early spring of this year. So for the safety of yourself and your loved ones, please continue to wear your mask, practice social distancing, wash your hands, listen to your doctor, follow the science, and get a flu shot. We're going to partner with the City of Detroit in not only providing our own sites for flu shots, but mobile units, and in particular going to populations and area of the city where flu shot compliance has been low over periods of time. And we're not going to only help provide flu shots for those particular communities, but we're going to make a contact, a relationship with them, so that ultimately when the COVID-19 vaccine comes along, we have an inroad to make sure that we're hitting high compliance rates there as well. So thank you very much.
Good afternoon. Karima Bentunsi. I'm the Detroit Medical Center CEO for Adult Central Campus. Thank you for having us today. As Mr. Mayor and my colleague from Henry Ford mentioned, we as the healthcare provider are behind and supportive of the city initiative. We urge all the patients and the community members to really get vaccinated for the flu. We have lived through the pandemic and we are all planning for a resurge. And I can remember the days when we had to get on a call with all my colleagues from the other health systems to discuss bed availability. You getting the flu shot will help us actually lessen the burden on the healthcare organizations so we are able to take care of our COVID patients in the event we do get a resurge. So please get the flu shot. We have, obviously, the city plan is comprehensive, has a lot of resources and clinics and centers for you to take it. But if you also need to be connected to a clinic or a provider, you can call DMC or you can call any of the other health systems and we will be able to connect you to a clinic or a provider. Again, similar stories to everyone else, was skeptical about the flu shot, but certainly had my fair share of getting sick in the past, and I've been getting it for the past 13 years, and thankfully I've been healthy. So again, please take your flu shot and make sure that you get vaccinated and encourage your family members and your neighbors to do the same. Thank you.
Thank you and good afternoon. Joe Hershey on behalf of Ascension and Ascension St. John Hospital and Medical Center located on Detroit's east side. Just as the mayor stated and our other healthcare colleagues that are with us this afternoon, we just want to further emphasize the importance of obtaining a flu shot this year. Obviously, this year, more importantly than maybe prior years, is the continued activity and the influx of COVID that plagues our community. Your ability to really recognize and understand that both COVID and the flu are respiratory illnesses, and to be able to protect yourself and arm yourself very early on in the health system, early on in the season rather, will work very, very well. Like the other healthcare providers, we're working hard to provide access for residents of the city of Detroit to be able to come to the health system either by way of curbside. We're also very focused on working with students and families alike and those that work in the educational system. We know that there's huge challenges this year in and around education, so we want to pay close and particular attention to students and their families. In addition to that, the elderly population, want to certainly emphasize the importance of the elderly taking an opportunity to obtain their flu shot as well. The overall health and safety of the community is what's paramount to all of us, and continuing to do our part individually by practicing good social distancing and keeping the rigor around active hand washing, and of course just practicing all of those good habits will continue to allow us to get through the cold and flu season as safely as possible. On behalf of our organization at Ascension, it's our honor and pleasure to partner with the City of Detroit, to partner with the other area health systems, and collectively we'll all do our parts to get through the cold and flu season. Thank you.
So before we take questions, I just want to say one thing to the 9,000 employees of the City of Detroit. The work you have done throughout COVID has been extraordinary, and I want you to know the efforts the city is going to take to make sure you're protected from the flu. And so in the coming weeks, the flu shots will be at the police precincts, they'll be at the firehouses, they'll be at the DDOT bus terminals, they'll be out at the DPW and General Service Department's yards, they'll be at our offices in Coleman Young Center and otherwise. And so we're going to make it as easy as possible for you. And if you want to bring your family members along, your family members will get flu shots as well. You're covered under your city health insurance policy anyway, but we are going to make it as easy as we possibly can for you to get your shot. And with that, we'll take any questions. You want to do the shots before the questions? Okay, I'll still be in shape to answer the questions after the shot. All right, so for the 16th year in a row, I'm going to get my flu shot, and all I can tell you is in 16 years, I've had no side effects and no flu. So hopefully the team here is just as good as the last 15 years. You really did get a sucker. All right. And so I guess with that, now we'll take questions.
ML Elric, Detroit Free Press. You already answered my first question.
ML, have you gotten your flu shot?
I just got a shingle shot, so
Okay.
I'm trying to pace myself.
All right.
But
Yeah.
yes,
Well, I know you're going to be the first guy in line for the COVID vaccine.
well, when I went, it depends who's giving it. But I was at CVS, and they are very insistent that you get the flu shot. So anybody who goes out there and isn't offered a flu shot, you're not going to the right place. But
Great.
you answered my first question. Are you going to cry? You didn't, so that's
Okay.
good. Second question, any embarrassing tattoos? No on that one, so that's good. Third question, these shots that people can get by calling or visiting the immunization clinic, are those free of charge?
Yes.
Okay. On the $11 million that is going to be spent on the speed humps, what is the source of that funds?
So it's the gas tax money. So we have a budget of, I don't know, $100 million or so for road repairs. And if you live in the city, you've seen lots and lots of road repairs done in recent years. So basically, we have a list of all the road projects we'd like to do over the next 5 years. I don't know, 500 miles of road. We'll push a few miles back a year that we won't get to in 2021 in order to pay for the speed hump. So it'll come from the gas tax funds.
And I know there's always confusion over what's a state road, what's a county road.
Right.
I expect most of the state and county roads are over the speed limit of 25 miles per hour, but are there any residential streets that wouldn't be eligible for this because they are not a city?
I can't imagine there's any state or county road at a 25-mile speed limit. Is there, Ron? No, so they're all city roads, yeah.
Okay, great. And last question for me. I know, I've been told you're a sports fan. The Big Ten is returning to play in all sports, especially football.
I'm trying to figure out how to get into the big house on October 24th. I don't know if they have to make me a team assistant or what, but,
Okay, so I take it, you think that's a prudent decision and you're in favor of that?
I thought the Big Ten made a mistake canceling too soon before the information was in, and I think they've done the right thing. Now, we will see what happens later in September and October and November. We'll see what happens with the SEC and with the ACC and the other conferences. But given what you're seeing in Ann Arbor, there's been almost no COVID infection among the Michigan football players. They certainly appear to be following proper protocols. And so the NFL, Major League Baseball, NBA, NHL, they're all playing. They've all demonstrated that if you're responsible, we can live with COVID and not infect each other. So, yes, I think the Big Ten made the right decision. I think they took too long doing it. And I'm hopeful we keep this under control. The governor might even let a few people into the stands.
Great, thank you very
All right.
much.
That's it? All right, thank you all very much.